Question 1. In the context of X-ray production, which of the following is the primary factor that contributes to the generation of characteristic X-rays in A. High-energy electrons striking the target anode, B. High-energy photons ionizing atoms in the detector, C. Interaction of electrons with the atoms of the anode, D. Magnetic field interactions between electrons and photons. Answer. Correct answer. C. Interaction of electrons with the atoms of the anode. Explanation. Characteristic X-rays are produced when high-energy electrons collide with atoms in the anode, causing the inner shell electrons to be ejected. This leaves a vacancy which is filled by an electron from an outer shell emitting an X-ray in the process. This interaction is essential in X-ray production in CT scanners. The other options involve processes related to the broader CT scanning but do not directly produce characteristic X-rays. Question 2. Given the circumstances of which method of data acquisition would be most appropriate when imaging a moving organ such as the heart? A. Step-and-shoot scanning, B. Helical scanning, C. Conventional field-based imaging, D. Positron emission tomography PET scanning. Answer. Correct answer. B. Helical scanning. Explanation. Helical scanning, also known as spiral scanning, continuously acquires data as the patient moves to the scanner. This method is ideal for imaging organs that are in motion, such as the heart, as it reduces the effects of motion artifacts. Step-and-shoot scanning is better suited for static organs. PET scanning is used for metabolic imaging, not anatomical CT scans, and conventional field imaging is outdated in C. Question 3. Considering the impact of patient positioning in CT imaging, Mr. Anderson, a 70-year-old patient with back pain, is scheduled for AK of his abdomen. What would be the best positioning technique to reduce radiation exposure while ensuring high-quality images? A. Laying the patient supine with a narrow field of view. B. Placing the patient in a prone position with an expanded field of view. C. Positioning the patient in an upright position to enhance contrast resolution. D. Laying the patient supine using the automatic exposure control system. Answer. Correct answer. D. Laying the patient supine using the automatic exposure control system. Explanation. The most effective method to reduce radiation exposure while maintaining image quality is using which adjusts the exposure parameters based on the patient's size and the area of interest. Placing the patient supine is common for abdominal scans. Reduces unnecessary radiation while ensuring adequate image quality. The other options are less effective at balancing radiation dose and image quality. Question 4. What factors contribute to the reduction of motion artifacts in AK of the chest? A. Increasing KVP and lowering mass. B. Using faster scanning techniques and sedation if necessary. C. Using a smaller field of view FOV. D. Applying iterative reconstruction algorithms. Answer. Correct answer. B. Using faster scanning techniques and sedation if necessary. Explanation. Motion artifacts in CT scans, especially in the chest, can be reduced by using faster scanning techniques, such as helical scanning, which captures the image more quickly. Sedation may also be necessary to prevent patient movement during the scan. Increasing KVP and lowering mass can improve image quality but won't necessarily reduce motion artifacts. Iterative reconstruction improves image quality but does not directly address motion artifacts. Question 5. Which of the following statements accurately describes the principle of ALARA as low as reasonably achievable in radiation protection during CT imaging? A. ALARA applies only to pediatric patients in CT scans. B. The principle encourages the use of the highest radiation dose that provides a clear image. C. ALARA emphasizes minimizing radiation exposure by optimizing techniques and using shielding where possible. D. ALARA refers solely to the management of radiation dose through equipment calibration. Answer. Correct answer. C. ALARA emphasizes minimizing radiation exposure by optimizing techniques and using shielding where possible. Explanation. The ALARA principle is designed to minimize radiation exposure to patients while maintaining diagnostic image quality. This involves optimizing scan parameters, e.g. MES-KVP, and using shielding to reduce unnecessary exposure. It applies universally to all patients, not just pediatric ones, and does not encourage high radiation doses. Question 6. In light of recent developments in CT technology, how can metal artifacts in of a patient's hip prosthesis be reduced? A. By increasing the kVp and using low-dose protocols. B. By applying beam hardening correction algorithms and using metal artifact reduction software. C. By using a high field strength MRI instead of ET. D. By placing the patient in a prone position to avoid metal interference. Answer. Correct answer. B. By applying beam hardening correction algorithms and using metal artifact reduction software. Explanation. Metal artifacts occur in dense materials, such as prostheses, cause a disruption in the X-ray beam leading to image distortion. Beam hardening correction algorithms and specific metal artifact reduction software can significantly reduce these artifacts in CT imaging. MRI is an alternative imaging modality but does not address the need for CT-based imaging. Increasing kVp may exacerbate artifacts rather than reduce them. Question 7. When considering pediatric CT imaging, which strategy would be most effective for reducing radiation dose while maintaining diagnostic image quality? A. Always use the same radiation dose settings as for adult patients. B. Use a reduced radiation dose setting specific to pediatric patients based on body size. C. Eliminate the use of contrast agents in pediatric CT scans. D. Increase the field of view (FOV) to encompass more body regions for comprehensive imaging. Answer. Correct answer. B. Use a reduced radiation dose setting specific to pediatric patients based on body size. Explanation. Pediatric patients are more sensitive to radiation, so using a reduced radiation dose specific to their size is crucial. Adjusting the settings based on body size helps minimize unnecessary radiation while ensuring that the scan is diagnostically useful. The use of contrast agents can be necessary depending on clinical situation and does not inherently increase radiation dose. Increasing the FOV may result in unnecessary exposure. Question 8. During a ICAR MMS, Rodriguez's contrast media injection extravasates into the surrounding tissue. What should be the first course of action for the radiographer? A. Notify the physician immediately and monitor for signs of systemic reaction. B. Apply heat to the affected area to help absorb the contrast media. C. Remove the needle and continue the scan without informing the patient. D. Re-inject the contrast media in another vein on the opposite arm. Answer. Correct answer. A. Notify the physician immediately and monitor for signs of systemic reaction. Explanation. Extravasation of contrast media is a serious complication that requires prompt attention. The radiographer should notify the physician, monitor the patient for signs of adverse reactions, and provide appropriate first aid. Applying heat may be helpful but should not be the first step. Re-injection of contrast in a new locus inappropriate until the situation is assessed by the physician. Question 9. From the perspective of radiation safety, which CT scanning technique would most effectively reduce the radiation dose during routine imaging of the abdomen? A. Using a higher kVp setting for better contrast resolution. B. Implementing automatic exposure control to adjust radiation dose based on patient size. C. Reducing the FOV to focus solely on the abdominal area, excluding surrounding tissues. D. Increasing scan duration to capture multiple images for better resolution. Answer. Correct answer. B. Implementing automatic exposure control to adjust radiation dose based on patient size. Explanation. EEC systems are designed to adjust the radiation dose in real time based on the patient's size and the area of interest. This helps minimize radiation exposure while maintaining image quality. Higher kVp settings may lead to unnecessary radiation. Reducing the FOV to exclude surrounding tissues is important. Should not be done at the expense of image quality, and increasing scan duration does not directly improve radiation safety. Question 10. Which of the following best describes the role of contrast in CT imaging of the chest, particularly when diagnosing pulmonary embolism? A. Contrast is not needed in chest CT as it can mask the pathology. B. Contrast enhances the vascular structures, making it easier to detect embolisms. C. Contrast should only be used for imaging of the heart and not the lungs. D. Contrast can cause artifacts that obscure the P diagnosis. Answer. Correct answer. B. Contrast enhances the vascular structures, making it easier to detect embolisms. Explanation. In CT imaging for pulmonary embolism, contrast is essential because it enhances the vascular structures, making embolisms more visible. This allows for clearer identification of blockages in the pulmonary arteries. Contrast does not obscure the diagnosis, but instead improves diagnostic accuracy. It can be used for both and lung imaging in appropriate clinical scenarios. Question 11. In a context of computed tomography, CT, a patient named Esther Harrison has been referred for an EK of the abdomen to evaluate potential masses. During the scan, the radiologic technologist notices an increased level of noise in the images despite using standard scanning parameters. The technologist is aware that noise is a common issue in CT imaging. What is the most likely cause of the noise in Esther Harrison's CT images? A. High setting resulting in excessive radiation exposure. B. Insufficient contrast agent administration during the procedure. C. Insufficient number of slices during the data acquisition. D. Insufficient detector efficiency or poor calibration of the CT scanner. Answer. Correct answer. D. Explanation. Noise in CT images can arise from various sources, including insufficient detector efficiency, poor calibration, or low-quality scanning parameters. In this case, the most likely cause of noise is related to issues with detector efficiency or calibration. High settings, option A, could increase radiation dose but do not directly affect noise. Inadequate contrast, option B, would result in poor contrast resolution. Noise in sufficient slices, option C, would affect resolution rather than noise. Question 12. Given the circumstances, Dr. Patel is conducting a scan on a pediatric patient to assess potential abdominal injuries. The patient's age and size require special consideration regarding radiation dose. What is the most appropriate course of action to minimize radiation exposure during this CT scan? A. Using the highest setting for better image quality. B. Applying automatic exposure control to adjust the radiation dose based on the patient's body size. C. Reducing the number of slices for a quicker scan. D. Using the highest kVp setting to reduce image noise. Answer. Correct answer. B. Explanation. In pediatric CT imaging, minimizing radiation exposure is critical. An automatic exposure control adjusts the radiation dose according to the patient's body size, thus reducing unnecessary exposure. High settings, option A, would unnecessarily increase radiation. Reducing slices, option C, or using high kVp, option D, would either compromise image quality or increase image noise. Not ideal for diagnostic accuracy. Question 13. When analyzing the results of ECN, Otterlong notes the presence of partial volume averaging in the image, which has affected the interpretation of small structures. Which of the following best describes the effect of partial volume averaging in CT imaging? A. It increases spatial resolution, allowing better differentiation of small structures. B. It leads to the blurring of structures, making it difficult to differentiate them. C. It results in increased contrast resolution. D. It minimizes the impact of motion artifacts. Answer. Correct answer. B. Explanation. Partial volume averaging occurs when a voxel in a E-ish contains tissues of different densities, leading to blurred or average pixel values. This makes it difficult to differentiate small structures. Option B. Increasing spatial resolution, option A, would reduce this effect, while partial volume averaging typically reduces contrast resolution, option C. It does not mitigate motion artifacts, option D. Question 14. Mr. Williams is undergoing a contrast-enhanced CT of the chest for suspected pulmonary embolism. The imaging technologist notices that the images exhibit significant beam hardening artifacts leading to streaking along the central axis of the chest. What is the most appropriate method to correct for beam hardening in this case? A. Increasing the tube voltage AVP to enhance tissue penetration. B. Applying a filter to the X-ray beam to reduce low-energy photons. C. Reducing the patient's size through repositioning. D. Utilizing iterative reconstruction techniques to reduce streaking artifacts. Answer. Correct answer. B. Explanation. Beam hardening occurs when lower energy photons are absorbed by the body, leaving higher energy photons that result in streaking artifacts. The most effective correction is to apply a filter to reduce the number of low-energy photons. Option B, increasing KVP. Option A could worsen the artifacts by enhancing photon penetration, reducing patient size. Option C is not feasible and would not address the hardening issue. Iterative reconstruction. Option D can reduce some artifacts, but not specifically beam hardening. Question 15. Illustrated by recent studies, the concept of pitch in helical CT scanning refers to the ratio of the table feed to the slice thickness. In the case of Mr. Evans, who requires a cardiac CT angiogram, which of the following would be the best pitch setting to ensure high-quality imaging of his coronary arteries? A low pitch value for improved spatial resolution and reduced motion artifacts. B, a high pitch value to speed up the scan time and reduce the radiation dose. C, a high-pitch value for better contrast resolution and faster acquisition. D, a low-pitch value to reduce the radiation dose while maintaining image sharpness. Answer. Correct answer. Explanation. A low-pitch setting in helical CT results in slower table movement, which increases scan time but improves spatial resolution and minimizes motion artifacts. In cardiac CT angiography, where motion and small vessel resolution are critical, a low pitch ensures high-quality imaging. Option A. High pitch. Option B and C may speed up the scan but at the cost of spatial resolution and increased artifacts, while a low pitch reduces radiation dose slightly. Option D. Its primary benefit is image quality. Question 16. When evaluating the CT scan of Isis Gonzalez, a 65-year-old woman undergoing over the abdomen for suspected liver lesions, the images show a significant amount of noise despite using appropriate exposure settings. Which of the following is the most likely cause of the noise? A. Inadequate collimation leading to scatter radiation. B. The use of low osmolar contrast media that interferes with image quality. C. A decrease in the setting during the scan. D. Insufficient gantry tilt affecting the plane of imaging. Answer. Correct answer. C. Explanation. Noise in CT images is often caused by insufficient radiation exposure, which can occur if the setting is too low. Option C. Collimation. Option A helps reduce scatter radiation but does not typically cause noise directly. Low osmolar contrast agents. Option B might impact image contrast but not noise. Gantry tilt. Option D affects image orientation but does not directly cause noise. Question 17. In response to the need for minimizing patient radiation dose, Mr. Miller is undergoing a pediatric CT scan. Which of the following best describes the most effective technique to minimize dose while still achieving clinically acceptable image quality? A. Increase for improved image sharpness. B. Use low KVP settings to reduce radiation exposure. C. Decrease the pitch of the CT scan to enhance image resolution. D. Apply automatic exposure control, tailored for pediatric patients. Answer. Correct answer. D. Explanation. Automatic exposure control is designed to optimize radiation dose based on the patient's size and body area, especially in pediatric imaging where minimizing radiation is crucial. Option D. Increasing MAR. Option A increases dose and is not ideal for dose reduction. OKVP. Option B can reduce dose but may compromise image quality. Decreasing pitch. Option C would affect scan speed and increase dose unnecessarily. Question 18. A patient named Isis Lee is undergoing AK of the chest for suspected lung carcinoma. The technologist notices that there are visible artifacts in the reconstructed images due to motion. Which of the following actions would best reduce motion artifacts in this scenario? A. Increasing to reduce exposure time. B. Decreasing the KVP to OA radiation dose. C. Implementing breath hold techniques to stabilize the patient. D. Using a higher pitch to reduce scan time. Answer. Correct answer. C. Explanation. Motion artifacts in CT scans are often caused by patient movement during the scan. Implementing breath hold techniques. Option C stabilizes the patient and reduces motion. Increasing MAR. Option A could increase exposure but doesn't address the motion issue. Decreasing KVP. Option B would reduce dose but wouldn't eliminate motion artifacts. A higher pitch. Option D may reduce scan time but can lead to poorer image quality and more artifacts. Question 19. Mr. Barnes is undergoing a contrast-enhanced CT scan of the abdomen to assess for possible tumors. The scan images exhibit streaking along the vascular structures consistent with metal artifacts. What is the most effective method for reducing these artifacts? A. Using a longer scan time to allow better penetration of the X-ray beam. B. Applying a metal artifact reduction algorithm during image reconstruction. C. Using higher AVP to enhance the X-ray beam quality. D. Reducing the contrast dose to minimize interference with the X-ray beam. Answer. Correct answer. B. Explanation. Metal artifacts, which typically appear as streaks or distortions in CT images, can be reduced effectively by using specialized metal artifact reduction algorithms during image reconstruction. Option B. Longer scan times. Option A. May not help reduce metal artifacts and could increase patient dose. Higher KVP. Option C. Can worsen artifacts while reducing contrast. Option D. Doesn't metal artifacts directly. Question 20. In a context of CT angiography, ETA, a patient named Isis Thompson requires imaging to evaluate the vascular system for potential aneurysms. What is the most important factor to consider when choosing the contrast agent for this procedure? A. The osmolarity of the contrast agent to ensure rapid opacification. B. The iodine concentration to match the size of the aneurysm. C. The patient's renal function and potential for contrast-induced nephropathy. Sin. D. The viscosity of the contrast agent to reduce injection discomfort. Answer. Correct answer. C. Explanation. For CT angiography, the most important factor to consider is the patient's renal function to prevent contrast-induced nephropathy. Sin, particularly in patients with pre-existing kidney conditions. Option C. Osmolarity, option A, and iodine concentration, option B, are important for achieving optimal image contrast but are secondary to renal considerations. Viscosity, option D, is relevant for injection comfort but does not outweigh sin risks. Question 21. During a IP fusion study for stroke evaluation, the radiologic technologist notes significant delay in contrast arrival in the left cerebral hemisphere. What does this most likely indicate in terms of cerebral physiology? A. A region of chronic infarct with calcified vessels. B. A cerebrovascular occlusion leading to reduced cerebral blood flow. C. Motion artifact due to patient movement during acquisition. D. A venous sinus thrombosis affecting contrast outflow. Answer. Correct answer. B. Explanation. A delay in contrast arrival time during APE fusion study suggests reduced cerebral blood flow, often due to an arterial occlusion. E.g. MCI stroke. Chronic infarct. Say a static and wouldn't show perfusion delay. Motion artifact. C. Affects image clarity but not contrast dynamics. Venous sinus thrombosis. D. Affects drainage, not arterial inflow. Question 22. A technologist performing a ERAM schedules a delay scan 10 minutes after contrast administration. What is the purpose of the delayed imaging phase in this protocol? A. To visualize arterial enhancement in the kidneys. B. To assess the renal parenchymal phase of enhancement. C. To evaluate the excretory function of the kidneys and ureters. D. To assess vascular malformations in the renal arteries. Answer. Correct answer. C. Explanation. The delayed phase in a ERAM, typically at 8-15 minutes post-injection, evaluates the excretory function showing contrast within the calyces, renal pelvis, ureters, and bladder. Earlier phases assess vascular A, B, or parenchymal detail renal artery malformations. D, are better visualized in the arterial phase. Question 23. During a elenography, the patient experiences discomfort and distension after co-insufflation. What is the safest next step? A. Stop insufflation and notify the radiologist immediately. B. Continue insufflation until the maximum volume is reached. C. Reposition the patient to relieve gas buildup. D. Administer oral analgesics and continue with the scan. Answer. Correct answer. A. Explanation. If the patient experiences significant discomfort during co-insufflation, the safest response is to stop the insufflation and alert the radiologist to rule out complications like bowel perforation. Continuing insufflation. B. Is dangerous. Repositioning. C. May delay needed intervention. Analgesics. D. Mask symptoms but don't address potential complications. Question 24. A clinician notices that iterative reconstruction has been applied to recent scans instead of filter-back projection. What is the primary advantage of iterative reconstruction in modern CT imaging? A. Reduced slice thickness and increased scan time. B. Lower image noise with the ability to reduce radiation dose. C. Greater scan coverage without increasing contrast volume. D. Improved visualization of metallic implants. Answer. Correct answer. B. Explanation. Iterative reconstruction allows for significantly lower image noise, enabling dose reduction without sacrificing image quality. Option is incorrect because it's not related to image noise. Option C refers more to detector weight and pitch. Option D can improve with MAR algorithms, but isn't the main benefit of iterative reconstruction. Question 25. A patient undergoing AKI has an implanted pacemaker. What is the most appropriate precaution the technologist should take prior to scanning? A. Notify the cardiologist for potential reprogramming. B. Remove the pacemaker leads temporarily. C. Increase the kVp to ensure image clarity. D. Avoid any contrast administration. Answer. Correct answer. Explanation. CT radiation can potentially interfere with pacemaker functionality, especially during prolonged exposure. The cardiologist should be informed to assess the need for reprogramming or monitoring. Removing leads. B. Is not feasible. Increasing kVp. C. Doesn't mitigate pacemaker risks. Contrast. D. May be needed and is not contraindicated due to pacemaker presence alone. Question 26. A severe trauma patient reveals multiple artifacts resembling starbursts near spinal hardware. What is the most effective image processing strategy to minimize these artifacts? A. Apply high-pass filters to the image. B. Decrease slice thickness and apply methyl artifact reduction algorithms. C. Increase tube current to overpower the artifacts. D. Use dual entity CT to exclude metallic components. Answer. Correct answer. B. Explanation. Methyl artifact reduction algorithms combined with thinner slices can effectively reduce starburst artifacts caused by spinal hardware. High-pass filters A. Don't address beam hardening or scatter, increasing MAR. C. Increases dose without improving artifact suppression. Dual entity CT. D. Helps in characterization but doesn't exclude methyl. Question 27. In the context of bolus tracking for pulmonary angiopathy PA, where should the region of interest ROI be placed? A. In the left ventricle of the heart. B. In the superior vena cava. C. In the descending aorta. D. In the main pulmonary artery. Answer. Correct answer. D. Explanation. The main pulmonary artery is the correct site for ROI and bolus tracking for E to PA. This ensures imaging is timed for peak opacification of the pulmonary arteries. Placing the ROI in the aorta C or vena cava B may result in suboptimal timing. The left ventricle A is more relevant for coronary CTAS. Question 20. A 42-year-old female patient is undergoing oikiath contrast. Shortly after injection, she reports itching and developed mild urticaria. What is the appropriate response? A. Immediately stop the scan and administer epinephrine. B. Continue the scan and observe the patient until symptoms resolve. C. Stop contrast administration and provide aura-Oryman antihistamines. D. Initiate CPR and activate emergency code. Answer. Correct answer. C. Explanation. Mild allergic reactions like itching and urticaria should be managed by stopping the contrast and administering antihistamines. Epinephrine A is reserved for anaphylaxis. Continuing the scan B without intervention is inappropriate. CPR D is not needed for mild symptoms. Question 29. Which parameter has the most direct effect on patient radiation dose during A. Examination? A. Gantry rotation speed. B. Detector array width. C. Tube current MAR. D. Window level settings. Answer. Correct answer. C. Explanation. Tube current MAR directly influences the number of photons produced, thereby having a significant impact on patient dose. Gantry speed A and detector width. B. Affects scan time and coverage. Window level. D. Affects image display only, not dose. Question 30. A radiologic technologist is preparing a ethnography study. Which of the following is critical to ensure bowel lumen distension and diagnostic accuracy? A. Fasting 24 hours before the scan. B. Administration of romanoglucagon immediately before scanning. C. Use of carbon dioxide insufflation. D. Drinking 1.5 liters of neutral or contrast prior to scanning. Answer. Correct answer, D. Explanation. CT enterography requires adequate bowel distension with neutral or contrast agents like water or low-density barium sulfate. Fasting alone, A, does not provide luminal contrast. Glucagon, B, reduces peristalsis but doesn't distend the bowel. Co-insufflation, C, is used in CT colonography.